friends and our non-medical faculty who made this happen every time. We've been doing this for last 22 years. And of course, graduates, you are special. Do you know why you are special? Because you survived 2 COVID waves and you struggled and you learned so many things and successfully graduated, and you made your parents very proud. Look at them, how eagerly they are taking your pictures and looking at you with all smiley faces. Thank you very much, all the parents who handed over your children about 5.5 years ago. We promised that we make them successful doctors. That's what they are today. You should be very proud of them, and it is just the beginning of your career. Your degree is just to learn your profession. Just the beginning of your beginning. And SPS, as you know, is always popular. Last counseling, I think, after Usmania Gandhi, majority chose to get admitted in SPS. And do you know the reason? The reason being the graduates. People go out, they bring the popularity or famous, make the institute very outstanding. It's because of you. And you are because of the faculty, the infrastructure, and supporting staff. End of the day, you only can bring the fame to the institution. Don't forget, this is the rural area and you worked very hard in these conditions to become a successful doctor. Spend some time giving back to the society where you become a good doctor. So come back as postgraduates, come back as faculty. If not, come back to this area to serve some of the people around. It makes everybody proud and yourself very happy. I'll tell you a few tips how to become a successful doctor. Do you know how to become a successful doctor? And who is a successful doctor? It's not your knowledge, it's not your experience that makes you successful, because you are judged by the patients, your colleagues, and your society, how good or otherwise you are. And I keep saying on every graduation day that ABC of your profession you should not forget. That's your attitude towards your colleagues, towards your parents, towards your society, and towards your patients. That makes, because patients, like we become patients sometimes, so they're very intelligent. They can assess you just looking at you, how good you are. And of course, your behavior towards the patient and rest of the people I mentioned, it makes a big difference. And C is communication. 50% of medicine is communication. How good you communicate with the patients, your colleagues, and the society. Other day I saw one patient, a bunch of investigations. He had MRI scan of every part, PET CT, PET scan. And you've seen about many doctors, maybe 10, 12 doctors, they are not happy He's not happy because they couldn't find anything wrong with him, or they could not say what is wrong with him. He went around, consulted all the specialists, did many investigations, and everybody said we could not find anything wrong with you. In a way, that's a good thing, could not find. But they don't, I think most of the, probably, doctors did not listen to him, what was wrong with him. The problem was his grandmother died of cancer, bone cancer. So he's very concerned. Even smallest pain, he thinks it may be because of bone cancer. So all the investigations are normal. You have to listen to the patient. I keep saying, a good listening person will become a good doctor. Unless you listen to the patient, what is their concern? You must not carried away by X-rays, by MRI scan, by investigations. Sometimes they may be abnormal, but it may not be relevant to that particular patient. They may not be causing any problem. So unless you listen to the patient, you won't be able to understand the problem. And sometimes you diagnose things which are not required, especially in this commercial world. You should not be doing unnecessary investigations. So it's very important. You must project yourself. Unfortunately or fortunately, people judge us, especially the patient judges. So it is important how you present yourself to the patient. When they come to your room, consultation room, they would have understood by the time they received in your clinic area. People might have told about you, how good doctor you are. When you enter, how you wish them, and always wish them by name. Don't ask the name when the patient is next to you. You wish them by name. You should know beforehand who is coming in the patient, what is their problem, and ask them to sit down before you talk to them. Make them comfortable, because coming to hospital itself is very anxious. So when they come to you, make them comfortable, talk to them, going down to their level. Then only they will come out the real history. Then only you become very popular doctor. And of course, as I said, I think you have to give back to the society. Nowadays, there's so many opportunities to become successful or become very popular. Though so many specialities have come up, you can venture into anything. We have experienced COVID. Even now we don't know many things about COVID. You can enter into research, find out what medicine, what vaccine is very effective. Recently, yesterday we heard the fourth wave might come. Numbers are increasing. That's why Dr. Joshi was warning you to be careful. You should be careful, because unless you're careful, it will be difficult, because the long-term effects of COVID are very bad. I see every day 3-4 people post-COVID affected with hip avascular necrosis, needing replacement. So the long-term effects are very bad, and it can be any system. And this girl who passed away yesterday, she had COVID, and the doctors suspected maybe there may be intracranial thrombosis, which is one of the long-term complications of COVID. So protect yourself. And the other thing, you must look after your health. I keep saying, unless you are healthy, you cannot look after your family, you cannot look after your parents. Keep yourself healthy, spend some time on yourself, and enjoy what you do. As Joshi said, don't take a profession just because you make more money or you become very popular in that profession. Take up a specialty which you enjoy. justify the profession and you won't become successful, because whatever you do, you should be able to do honestly and with full heart, and should be able to enjoy. And there's so much of scope. I think Joshi was telling other day, last year we published nearly 300 papers, publications in index journals, which is a big event. I don't think many medical colleges would do this. The Harvard Medical College is popular, or Oxford is popular, not because of their building, not because of anything else, because of their publications. They publish so many research papers, they publish so many textbooks. So I want some of you to be part of the research publication, and some of you should write textbooks for medicine, which is not difficult. You might have realized some of the books are not good and you want it in a different way. So you could do little research and make a textbook from any specialty which will be easy to understand, which is more practical. And there's so much technology is available to do that. And you can collect the latest information to do that. So I think probably, as I said, this is not the end. Choose up a profession or a career which will make you happy, enjoy. The girl who won about 22 medals, she was telling about super specialty. She wants to take radiology. Radiology, one of the top specialty to do good work, especially the neuroradiology. You might have seen significant number of neurological diseases cannot be treated, but now because of the neuroradiology, intervention radiology, we are able to do some of the treatment. So some of you can take up these super specialties and become an expert. Every specialty is good, provided you are at the top of that specialty. And the SPS students, at the tradition, they are always on the top of the specialty, whatever they choose. Yesterday I met Sujata. She is 99 batch, first batch. I don't think many of you remember. She settled in Australia, one of the leading cardiologists. She came back to get her mother operated. She had knee replacement yesterday. She was telling about SPS students, how good, how successful they are. It seems last year nearly 20 resident places are secured by SPS students. And Joshi was telling you, significant number of postgraduate seats as well as super specialty MCS DM seats were secured from SPS. So I want you to be part of that. This is a great evening. I'm sure you can never forget this. Wish you all the best. Have great time and a healthy, a successful life. Thank you, all of you, coming here and attending this great function. Thank you.